Welcome to The Healthline, issues that shape our well-being. I'm your host, Dr. Andrea Alt-Brutus. In The Healthline, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights that help us gain a better understanding of our ever-evolving, complex healthcare system. Today, I am absolutely thrilled to welcome New York State Senator Siela Bynoe. Senator Bynoe's accomplishments are long, but I'm going to read just a few highlights from her extremely impressive bio. Senator Bynoe was formerly a part of the Nassau County Legislature, where she served 5 terms as the representative for the 2nd Legislative District, which includes the communities of Hempstead, Hicksville, Lakeview, Malvern, Newcastle, Rockville Center, Uniondale, Westbury, and West Hempstead. As a Nassau County legislator, she earned a reputation as a diligent and innovative lawmaker with the ability to build bipartisan consensus for initiatives that benefited Nassau County residents. She has been a longtime advocate for mental health, passionate about the environment, and a fighter for women's health and health equity. She is also a proud Hofstra alum, having received her bachelor's degree in psychology from Hofstra University. In November 2024, Senator Bynoe was elected to represent Senate District 6 in the New York State Senate, becoming the very first Black state senator to represent Long Island in the Chamber's 247-year history. Senator Bynoe, welcome to the Healthline.
Thank you, Dr. Alt-Brutus. It's a pleasure to be here, pleasure to be back on campus where, some of this work started.
Well, we're absolutely thrilled to have you here on the podcast. So one thing that people may not know about you is that you're a breast cancer survivor. Black women have the lowest survival rate for every known stage of breast cancer, according to the American Cancer Society. Breast cancer is diagnosed later in Black women, and they have less access to high-quality care. The very first bill you introduced as a state senator is legislation that would expand insurance coverage of breast cancer screenings. How would that work? And do you see it having an impact on the health outcomes of Black women in particular?
The bill is geared toward making sure that individuals who have breast cancer in their family history within the first generation, that they are then able to access additional testing. Aside from a traditional mammography, they would be able to also get a sonogram. And it's in many cases that sonograms are the leading contributing factor to actually having a diagnosis. So I believe that it's important that we reshape our insurance practices so that we can meet the challenge that we have found that exists in breast cancer as it relates to African American women.
There's a lot of data coming out now about the importance of sonogram, especially for women with dense breast. And I know that a lot of African-American women have dense breast.
That is
so that's
correct.
very important that this type of legislation is passed so that we have that additional screening to hopefully catch early detection of breast cancer.
100%. And I'll tell you, even through my own diagnosis, that while the mammography showed some suspicious activity, given my age, and the fact that I had dense breasts, the doctor wasn't all that alarmed. But it was once they did the sonogram, they knew they needed to go the next step to do the actual biopsy. I was in a position because I had just witnessed one of my friends who also was under the age of 40 get diagnosed with breast cancer. Because of that, I was more persistent and diligent to ensure that I received all of the testing that was available to me at the time. So I just want to try to remove some of those barriers and impediments for women who would, have a diagnosis knowing that there might be some generational history. That was not the case for me. I did not have any predisposition, but despite that, I wanted to make sure that we had an opportunity for women who might have that experience.
Yeah. Well, good thing you were very proactive when you were younger in getting that follow-up screening and unfortunately having someone who was going through it as well, but learning from that person's experience that you maybe want to go and get some follow-up testing for yourself. And you were relatively young also when you were diagnosed, so it's good that you did follow up.
Yep, 35.
Yeah, pretty young, pretty young. You have been a fighter for so many different health topics, one of which is for water quality issues that's being faced by the village of Hempstead, where the wells that provide drinking water have 3 to 11 times the acceptable level of dioxin. Before leaving the county legislature, you secured $1.75 million in American Rescue Plan Act funding for upgrades that would allow the village of Hempstead to remove such emerging contaminants. From a public health perspective, why is it important to upgrade water infrastructure?
My story, I think, is a prime example. I did not have the predisposition to breast cancer based on the BRCA gene. And nonetheless, I was diagnosed. It's likely because of what we're drinking, what we're eating, or what have you. But we do know for certain that 1,4-dioxane can lead to cancer of the kidney and the liver and the like. And so we need to remediate those contaminants from the water to make sure that we're providing the best quality drinking water for our communities. And so while Hempstead is grappling right now, there are many water providers across the state that are also challenged with having, the remediation process. Being that Hempstead really needs to build out a whole new water filtration system, we wanted to get that 1.75 into the community so we could start the demolition and some of the construction of the building that would house all of the equipment that would filter out the 1,4-dioxane. And so very happy that I was able to be one of the warriors along with legislator Scott Davis to secure that money and make sure that Hempstead has an ability to start the work and be able to remediate, because 11 parts per billion of 1,4-dioxane is extraordinarily high, and we want to be able to meet that challenge and mitigate as quickly as possible.
Well, thank you so much for fighting for those living in the village of Hempstead, you and legislator Scott Davis, so thank you for that effort. While you were in the county as a legislator, you secured the amendment to a policy that provided incentives for projects that would mitigate pollution in disadvantaged communities. So can you tell us more about how this connects to people's health?
When we went through COVID, the one thing that we kept hearing, kept popping out at us from news publication to news produced on TV and radio, was that majority minority communities had higher impacts and also worse outcomes as it related to contracting COVID. Why? Because many of our community members are, essential workers, were out there working every day, and also had, unfortunately, compromised immune systems, or were going home to family who had compromised immune systems. As a result, I started looking at data, and I realized that Newcastle had higher rates and worse outcomes than even its nearby neighbor in Westbury. Why is that? Their proximity to some of the industrial neighbors and companies that are just, within hundreds of feet from their home were emanating particular particulate matter into the airways, waterways, and the like. So the respiratory issues in particular were a significant challenge during COVID. So I wanted to find a way to encourage those industrial entities and facilities that are in proximity to majority minority communities by way of environmental justice to have an ability to encapsulate and mitigate any particulate matter that is currently meeting the airways. And so I went to the IDA, the Industrial Development Agency that typically gives out pilots to create jobs, create affordable housing, and said we should be using this program to also meet the challenges of environmental justice that some of these communities face here in Nassau County. And so I wrote the policy, presented the policy, testified before the industrial agency, and they accepted the policy. Now at a state perch from where I sit, where the IDA law is actually enabled, I went back and I said, well, we should make this a responsibility and make this an opportunity across the state. So I'm now writing state law, and I think we're filing this afternoon, that will take this pilot that we did here in Nassau and present it on a statewide issue. way.
That's amazing. That's amazing. I just also want to note, you mentioned COVID-19. You were one of those voices who are really fighting for testing and for vaccines in communities of color. I was the former director of health equity at the Nassau County Department of Health, and we were in the trenches just really
Together.
trying to get those testing kits within our fully qualified health centers, which are thankfully located in those communities that were hardest hit by COVID-19. So I just want to say thank you for all the work that you did during that time as well.
Yeah, we were great partners together,
Thank you.
along with Dr. Eisenstein and,
Yes.
of course, our county executive of the time, Laura
Yes,
Curran.
yes.
And I think that the work we did was very thoughtful. It was well thought out. It was impactful.
Yeah.
We had to meet a need that no one saw coming. And so I'm very thankful for your partnership in that experience.
And also thankful to our community partners as well. Your help with connecting with a lot of our faith-based leaders and just our community leaders in general. Like, we could not have done that work without them as well.
Without them at all.
Yeah.
And the FQHC, under the leadership of
David
Mr. Nemroff, I will tell you, was second to none. When I called him and said, I need you. Your facilities are perfectly situated. Your facilities are perfectly engaged with the communities that we need to get tested, because we started in the testing phase. Remember, we had all these booths outside that were put up by Nassau County PD, the tents and all of this, and they came in and they were given the PPE from the county, and we tested tens of thousands of people and were able to get them vaccinated. And remember that we sent them home with food.
Yes.
That was what I wanted to see. I wanted to see the testing, and we didn't want people to get tested. They came there only because they were symptomatic, remember?
Yes.
We don't need you stopping at the grocery on the way home. We want you to go home. We want you to be able to go home with food and not worry about food in the immediate. So it was one of the sadder moments in time, but, out of those experiences, you get to see the best of your community,
Exactly.
and I'm happy to have done that with you.
Thank you. We became stronger as a result of it. So
100%.
now you are doing some wonderful work. One of the Senate committees you are a member of is the Mental Health Committee. You initiated a program for mental health first aid training while you were a county legislator. The latest bill you filed in the Senate continues this work at the state level. Can you tell us more about what this legislation will do?
At the county level, we made it state law. County law, that every county employee that was public facing, and that meant both physically and virtually, had to be trained in mental health first aid, so that when they engaged with our community, they could identify when someone's in crisis, de-escalate, and then do a referral. We need to go a step further. We need as many people out here in the community to be trained in mental health first aid. As a result, I think engaging people that are in our community who see individuals on a somewhat consistent basis, sometimes in their most vulnerable state, be able to have that training as well. The bill that I introduced would require for beauty experts, whether it's a barber, an esthetician, a nail technician, cosmetologist, hairstylist, to be trained in mental health first aid. It not only helps them identify, de-escalate, refer, it also will help to destigmatize, especially in Black and brown and immigrant communities, period, whether you come from Eastern Europe or you come from the Eastern Caribbean. We come here to this country, or we're in our communities, and we are to put up the strongest facade possible. And we're here to work, and we're here to make the next generation's load that much lighter, or their opportunities more attainable. And we tend to just trudge through things that, even when we are broken a little, right? So if you had a broken leg, you'd go get it set at the hospital and use whatever apparatus they gave you to get through life. We don't do that here. And we know that there's resources in this space of mental health. Yes, we still going to need to get through the day, our daily, but why not get that extra support that you might so desperately need in order to be able to meet the challenges that you currently face, whether it be childhood traumas or, situational things like loss of life, of family members or friends. I think having these experts be folks that are trained in mental health is an appropriate next step.
And what I absolutely love about this plan is that you're meeting people where they are. People are in the beauty shops, which, as you know, in the Black community is a really important place to be on the weekends.
The barbershop equally.
Exactly. And so you're meeting people where they are, and this is where those conversations tend to take place. So that's just beautiful that you're doing this.
I'm hopeful. It's filed, and we're seeking an assembly introducer, and we're hopeful that we can get it on a committee in the near future.
Great. Something else that you're doing in mental health that I also love, and I heard about it a couple of weeks ago when we were at the Roosevelt Library for their annual Women's Tea celebration, is the work that you're trying to do in libraries. So you have another bill you introduced in the Senate, which concerns your plan to place social workers in public libraries in economically disadvantaged communities. So I absolutely love this idea. Can you talk more about this concept? Why did you decide to do this and how it might be implemented?
Yeah, so again, meet people where they are. As I move around the Senate district, but more importantly, when I was a county legislator, I realized that in many cases, the library was where we saw the most vulnerable, was where we saw folks who didn't have access to technology at home. They came to the library. And through those relationships, they were vulnerable enough to say, listen, I'm looking for some training. They're looking to do more in life and get upskilled. We know that people come to the library sometimes, as a place for respite when there might be a challenge at home, and they come there. And so they're there. Why can't we wrap some services around those folks? Whether there's again, loss of life, a trauma that they're going through, or there's a desire for upskilling themselves, the library can be that place, especially as we seek to reimagine those spaces. To me, something that I wish I would say that I was the first who ever thought of it, but I'll tell you that libraries have been seeking to have social workers in their space, in so much they've been partnering with universities for interns to come and play that role in the space. What I am learning from those discussions is we want to see consistency in the engagement. So the intern comes, spends, whatever allotted amount of time in that community, and then they move on. If we were able to have full-time social workers who are dedicated to a specific library and community, there's consistency, which builds trust, which builds better potential outcomes. So that's why I introduced the bill. And again, we are looking to move that through, and hopefully it's already gained some support.
Great.
The Senate leadership under Andrea Stewart-Cousins, our leader has seen value in that. And so as a result, it made it to the Senate One House budget. And we're hopeful that it'll be in the final enacted budget when we eventually take that vote in the coming hopefully days.
Amazing. So I used to be a mental health disparities researcher. That's kind of what I primarily focused on. I absolutely just love this idea. Again, you saw this need for bringing that type of resource to where people were, where they are. So this is just an amazing piece of legislation, and I really do hope that it gets passed and gets fully implemented. We are about to wrap up our episode. I just wanted to see if you could share some parting words with our audience about why you are so passionate about health and health equity in general.
Health is wealth.
Yes.
Right? There's a lot of us that want to do good in life, whether it be for our immediate families or our communities. But at the end of the day, if we're not doing well, it's tough to do, right? So I always say you can do good when you're doing well. And I think that we need to be able to make sure that every community has access to health care and awareness of the programs and the services that exist. And so I've delved hands-on to make sure that even as a county legislator, every single piece of information that I knew could benefit any parts of our community, that I shared it. I've been working also to make sure, and I was thrust into this as a county legislator, that we're faced with one of the most important medical institutions in Nassau County known as NUMIC, Nassau University Medical Center, being at the brink of collapse in terms of financial deficits. We have to pay attention to these things. These are issues that impact not just individuals, but family as a whole and communities. And so I believe the best way to ensure that we are prosperous as a county is to make sure that we're healthy and that we have access to health care and that we look at disparities and look for ways to create parity so that everyone has an opportunity to succeed in life.
Exactly. Not just those who could afford it, but for every single person.
That's right.
Great. Well, thank you so much, Senator Bynoe, for joining us here at the Healthline, the Hofstra community, the community of Westbury, your hometown, and those who you serve are also proud of you. So thank you for joining us today.
Thank you for having me.
This wraps up another episode of the Healthline, Issues That Shape Our Well-Being. I would like to thank our studio engineer, John Mullen. I would also like to thank WRHU Radio Hofstra for their help with the production of this podcast. Lastly, I would like to thank Hofstra School of Health Sciences for sponsoring this podcast. I am Dr. Andrea Alt Brutus, and thank you for listening. Have a good day.
Bye.